Okay, so this is the balloon esophagostomy tube. So this tube is actually inside Mackie in the esophagus across the stricture. And this catheter is going down into the stomach. And this big tube comes up here to the feeding tube portion. So this is typically always closed, and we can administer food and medicine through here. But we usually don't have to. Usually everything is oral, okay? But if we need to, we could always put food or fluid through here as needed in medications, and Jess will show you guys how to do that later in case you need to. These two things will be sticking out of the bandage when you see Mackie, okay? The thick tube is the feeding tube, and the thin tube is the inflation for the balloon, okay? So on the top of the feeding tube is a balloon. It's actually two balloons. There's a high pressure balloon and then an expandable balloon on the outside of it, okay? And we've chosen the right size balloon for Mackie. So this is in the esophagus, and this tube allows us to inflate the balloon, okay? We've already pre-measured Mackie, and Mackie needs 6 inflation syringes to fill the tube, okay? So this is all wrapped. This is what you're gonna see. This feeding tube we don't really need to worry about. So this is the most important part. And as you can see, it says off. Off right now is pointing to Mackie, pointing to the tube. So we say this is pointing off to the patient, because this is going to the patient, okay? And then both of these are injection caps. So the first thing we're gonna do is take the injection caps off. These are on just to protect this so nothing gets in there, okay? And we're gonna take our inflation syringe. This is the inflation syringe. And you can see if I try and move it, nothing happens. You have to squeeze this handle to be able to pull back. And I can't push either unless I squeeze the handle and then I can push. That whistling you're hearing is because of this one-way synthesis valve. When I draw back, air is coming through here, and when I push air out, it's coming through here. There's no need to ever remove this from the syringe. So this all just stays just like this.
There's no need to remove what?
Any of this. Just this all stays as one piece, because this can unscrew. And I'll take pictures and I'll show you this. So what you're gonna do is the first thing is this screws in just like this.
Okay.
It always screws in opposite the patient.
Okay.
Okay? This 3-way stopcock that I showed you before is always off to the patient. Okay? When I'm getting ready to do a treatment, I turn it off to the atmosphere, and now it's open from the syringe to the patient. Okay?
So when it's aligned that way, it's closed?
This is off to the patient, so there's no way air can get in or out. This is off to the atmosphere, so now air can go from the syringe into the balloon. And this is off to the syringe, so air can escape the balloon and come out to the atmosphere.
And when do we want to do that?
I'm going to show you that right now. So the first thing we do is we hook this up, and as soon as we hook this up, we're going to turn off to the atmosphere, okay? Because this is atmospheric air. So we're off to the atmosphere. Now the syringe can fill the balloon, okay? And what we're going to do is you're going to see, as I inflate this, we're going to see this balloon inflate, okay? So if I pull back, 1, 2, 3, 4. That's 4 syringes is all it took to fill this balloon. Mackie has a bigger balloon. And you can feel this is pretty tight. When we fill that in Mackie, she's going to be a little bit uncomfortable. So as soon as we get to 4, in her case 6, because that's how many we're putting in her, we turn off to syringe and watch what happens.
It's going to close.
Okay, so that outer balloon sucks the air out.
So it's only a temporary discomfort, and then when we close it...
As soon as you do that, everything should be fine.
Okay.
If for some reason you don't hear that sound, did you hear that?
Sound? Oh, that air
Yeah, watch,
release.
I'm going to do it again, okay?
Air release sound.
1, 2, 3, 4, turn off. Listen.
Yeah.
If you don't hear that sound, it may be that this tube is kinked. And you just have to straighten everything out and the air will come out.
Okay.
And we wrap this so it doesn't kink. Then what we do, air's out of the balloon. We want to remove any excessive air in the balloon. So we pull back, turn off to patient. So now we're off to patient. This all comes off. We put our injection caps back on.
And it doesn't matter
And
which
we-
one
nope,
goes to which,
nope.
they're both interchangeable?
And now we feed Mackie.